Hello everyone, my name is Ricky L. Crumpton and I am an occupational health specialist at Inscudo Memorial Hospital. Welcome to New Hire Orientation. I'm excited about every one of you embarking on your new career here at Inscudo Memorial Hospital, and I have some information to share with you about ionizing radiation and its use in the hospital. So some of the new hires will not be working with ionizing radiation per se. However, it is still good to learn about it along the way and other new hires who will be working in the radiation department. I'm going to be sharing some insightful information I've gathered for this hospital, which will help you see how ionizing radiation will be used in the hospital. So, to level set this training module, I'm going to go over the objectives that we will be discussing in this presentation. First, we will learn what is ionizing radiation. Next, there are four types of ionizing radiation that we will learn about, such as alpha particles, beta particles, gamma rays, and X rays. And then the part that applies to all hospital faculty and staff is knowing how to utilize ionizing radiation. And then after that, we'll discuss some risk factors when being exposed to ionizing radiation as well. And then finally, we'll learn about the safety and prevention methods when handling ionizing radiation. So by the end of this presentation, everyone will be familiar with ionizing radiation and be competent with managing it within a hospital. So to begin, let's define ionizing radiation. Well, ionizing radiation is a form of energy that acts by removing electrons from atoms and molecules of materials that include air, water, and living tissue. Another factor of ionizing radiation is that it can travel unseen and pass through some materials. And then, as you can see on this picture, ionizing radiation is listed on the higher end of the electromagnetic spectrum. Next, we have four different types of ionizing radiation that we will discuss in this training, such as alpha particles, beta particles, gamma rays, and X rays. So these are considered the primary focus of ionizing radiation. So in the next few slides, we will spend quite a bit of time discussing in detail the different types of ionization radiation. First, we'll talk about alpha particles. So, alpha particles are positively charged and consist of two protons and two electrons. And also, they are traveled through air and they do receive a hard stop when trying to pierce any thin paper or tissues. When it comes to uses, we see alpha particles used in smoke detectors, such as when the smoke enters the detector, it reduces the amount of alpha particles that are detected and triggers the alarm. And then we have our static eliminators. With static eliminators, it uses the alpha particles to remove static charges from the equipment. And then we have our radioisotopic thermoelectric generators. Here, alpha particles generate heat, which is converted to electricity. And this is often used in space probes. Next, we have our beta particles. Beta particles are high energy, high speed electrons or positrons that are ejected from the nucleus. Also, by beta particles having a smaller mass, it is able to travel further in the air up to a few meters and can be stopped by a thick piece of plastic or even a stack of paper. So it can pierce thin paper, but it receives a hard stop when it receives or reaches a thick piece of paper. Beta particles are much less ionizing than alpha particles and generally do less damage for a given amount of energy being released. So when it comes to the uses of beta particles, we see it in the thickness detectors for the quality control of thin materials such as paper. We also see it in the treatment of eye and bone cancers, and we also see it being used for positron emission tomography, also known as PET scans. Then we have gamma rays. A gamma ray is a bundle of electromagnetic photons emitted by the nucleus. And gamma photons are the most energetic photons in the electromagnetic spectrum. So they are similar to X rays, but the difference is they are emitted from an excited nucleus. Also, with gamma rays, they can maneuver through the human body, but they stop by or receive a hard stop by lead, iron, or other thick metal plates. So when it comes to the uses of gamma rays, we see it in sterilization of medical equipment in hospitals. We also see it in the measurement and control of the flow of liquids in industrial processes. We also see it widely used in medical diagnostic studies such as brain, bone, liver, spleen, or kidney imaging, and also blood flow studies as well. Finally, we have our X-rays. X-rays are produced by electrons external to the nucleus. And also, X-rays have longer wavelengths and lower energy than gamma rays, which causes them to be more damaging to living cells. When it comes to the uses of X-rays, we see a large ranges of uses for medical, industrial, and research purposes. Industrial radiography can use X-ray or gamma sources for analysis to look for cracks in buildings, structures, or pressure vessels. Also, X-rays are used in security processes for baggage containing screening at airports. So let's move on to ionization radiation within a hospital. Ionizing radiation has a number of beneficial uses, including treating cancer or sterilizing medical equipment. When it comes to diagnostic radiology, the imaging using ionizing radiation produces images of internal structures, of human organs and physiological biological systems, and helps improve patient management and care in screening and diagnosis, also assessing treatment response and detecting disease recurrence. Then we have radiation therapy is used as a primary and curative treatment and adjunctive therapy. With radiation therapy, it utilizes ionizing radiation to treat malignant and benign diseases. It has become a standard of care for treating many types of cancer. Now we are down to the risk factors of ionization radiation. There are acute risks and chronic risks. With ionization radiation, if there is enough energy, it can damage DNA and cause cancer. So, certain medical procedures such as chest x rays, CT scans, PET scans, and radiation therapy can cause cell damage that leads to cancer. So, it is harmful if used incorrectly, and high doses may result in severe skin or tissue damage. When it comes to alpha particles, they can't penetrate normal layer of dead skin cells on the outside of our skin, but they can damage the cornea of the eye. So alpha particles are dangerous if inhaled, ingested, or if they are entering a wound. Next, we have our beta particles. With high intensity, it can cause burns, rather like severe sunburn. And then also with the beta emitting radionucleotides, if they are inhaled or ingested, they can also do damage to the internal cells and organs. Then we have our gamma and X rays. High exposures can cause direct acute effects through immediate damage to cells. Low levels of exposure carry a health risk where the probability of cancer induction increases with increased exposure. To be the best radiology techs, we have to know the prevention mechanisms. So, one of the best ways to protect workers from ionizing radiation is implementing a strong radiation protection program. A radiation protection program should include quality staff, a LARA, which is as low as reasonably achievable, surveys and area monitoring, worker training, emergency procedures, and internal audit procedures, to name a few. Also, each radiation area is required to have posted with a sign or signs with the radiation caution symbol and the words. Another prevention is maintaining time, distance, and shielding. With time, decrease the time spent in areas with elevated radiation levels. When it comes to distance, increase your distance from sources of radiation. And with the shielding, use shielding for radiation sources. Then we have our personal protective equipment, also known as PPE, which is used to prevent workers from being contaminated with radioactive material. PPE will not protect workers from direct external radiation exposure unless the PPE contains shielding material. So, when using PPE for radiation protection from X rays and gamma rays, you should use lead aprons or vests, lead thyroid collar, lead gloves, and safety goggles. So, in the closing of this training module about ionization radiation, you all have learned in detail about what is ionization radiation, the different types and ones you will encounter the most while working in the hospital. Those are gamma and X rays to review. Next, most of our job functions, if not some, you learn about what is required in the hospital when encountering ionization radiation. Then we discuss the hazards of being exposed to short term or long term use. And finally, we learned about some safety and precautionary methods when using ionization radiation. So, after all that, I believe everyone is ready to be the best radiation tech employees and to help our patients to live healthier lives. So, congratulations again on embarking on your career journey here with Inscudo Memorial Hospital, and we're glad you joined our team. Here is a list of references I used to create this presentation, and I can also email everyone a copy of this presentation at the end, and you all will be able to review in your downtime to remain knowledgeable about ionizing radiation. Thank you for your time, and I hope you have a great day.